ICE officials in Phoenix have confirmed an outbreak of mumps amongst migrants in several Pinal County detention facilities. Officials say at last count, they have had 56 confirmed cases of mumps, along with an additional 81 suspected in Pinal County ICE detention facilities. Pinal County spokesman Joe Pirates says out of all the cases of mumps reported so far, one of them is an employee, while the rest are all detained migrants.
We've got to make sure it doesn't get out. And right now, our steps that we're taking, along with the facilities that do have the ICE detainees, have been very cooperative in helping us keep this localized.
In an emailed statement to Cronkite News, ICE responded in part by saying, quote, "We instituted numerous measures to prevent the spread of communicable diseases, including an initial medical screening upon arrival and a full medical checkup within 14 days. Our medical team's quick reaction to the presence of illness has resulted in a very low transmission rate." Nevertheless, dozens of other detained migrants have had to be placed under quarantine.
Anybody who may be suspected of having the mumps are put into a pod with other inmates who are suspected of having that.
ICE officials say detainees diagnosed with mumps are typically at the facility less than a month, approximately the time it takes for the virus to incubate and symptoms to appear. According to Pirates, those who don't have the virus are released from quarantine after 25 days, which is the standard incubation period for mumps. But for those who do have the disease,
they are given the MMR vaccination.
And during the quarantine period, detainees still have access to resources.
They are still allowed to meet with their lawyers. They're still allowed to meet with family.
Health officials say despite the outbreak inside the detention facilities, there's no current threat to the community, and the most they can do at this time is make sure those migrants coming in are getting vaccinated.